Welcome to OAC Health Talks. I'm Joe Naglowski, President and CEO of the Obesity Action Coalition, and we are excited for you to join us for this educational series that dives deeper into specific health topics that we know are important to you and the OAC community. Health Talks are designed to empower you while providing straightforward, practical answers and insight from trusted experts. So let's dive into today's topic.
Hi, my name is Dr. Kimberly Gudzune, and I'm an associate professor at the Johns Hopkins University School of Medicine, and I'm also the medical director for the American Board of Obesity Medicine. And I was asked today to come and give a presentation to really highlight and describe what is an obesity medicine physician. So I think oftentimes for patients who are thinking about working with a physician on their weight, it's oftentimes really daunting. Where do you turn to? Who should you ask for help? And unfortunately, a lot of times the first experience that individuals may have is not always a positive one. So in my own obesity medicine practice, I've often heard patients say that they've heard from physicians over and over again, it's simple, you just need to eat less and move more. Or they are told that, that physician doesn't prescribe weight loss medications. Or finally, it's sort of dismissed of, let's talk about your weight some other time, that it's not a high enough priority, which I think is really frustrating when you're a patient who's wanting to work on this area. And so that really sort of is where obesity medicine comes in. And so I think it's first important to acknowledge that, primary care is often not really equipped to treat obesity. There's been a lot of scientific studies that show that physicians have really limited education and training on obesity treatment. And as a result, a lot of primary care providers are really not comfortable treating obesity. Primary care is also a really challenging setting to work in because you have so many different priorities that you're trying to balance in a very short visit time with a patient. And therefore, there's really just not enough time to give obesity treatment the time that it really needs. Other providers might be a little nervous to bring up weight, there's a growing recognition about weight bias and stigma, and so they don't want to offend a patient, and they're not sure how to bring it up. In addition, some offices might not have the proper medical equipment to accommodate all patients, and other offices might have inadequate resources to manage things like prior authorizations for medications and procedures. And so this is a really big challenge to ask primary care to take on, and that's really where obesity medicine can turn to. So really begs the question of where can I turn to find someone who can help me manage my weight? And again, this is where I think obesity medicine has a growing role, and we are physicians who actually specialize in this area. I wanted to give a little context around what are medical specialties. We have this general idea of what it is, but really, even as a physician, I didn't know all of this history until I really began doing some research in this area. And so back in the early 20th century, medical science was advancing, and physicians were really starting to focus their area of knowledge. And it was at that point in time that specialty boards were first created to really identify what is the content of this field and what are the boundaries. So how is ophthalmology different from dermatology? How is something like gastroenterology different from cardiology, to really set who does what? One of the other really important things in the United States is that specialty boards are actually independent of medical societies, and this allows those boards to set high standards and really thinking about how can we really ensure that this physician has the knowledge and skill in this area to really try to be a credible source for patients. So specialty boards oftentimes offer a board certification program. And so you'll hear that physicians are board certified in a certain field. And a certification program, the primary goal is to assess the knowledge, skills, and abilities required for a physician to competently perform within a field of medicine. And so it signifies two things. First, that the physician has met all the prerequisites, whether that's a degree or a certain training program. In addition, they also have to demonstrate that they actually have the knowledge and skills, which is typically done through examinations. And these can be written examinations. Some fields also have oral examinations that they give as well. So the American Board of Obesity Medicine, or ABOM, is the board certification for obesity medicine. And really the goal is to serve the public in the field of obesity medicine by maintaining those standards of assessment and credentialing for physicians. And really a physician who has ABOM certification signifies that they have that specialized knowledge in the practice of obesity medicine and distinguishes them as having achieved competency in obesity care. And this is really important given all of those educational gaps that I mentioned before, that physicians who have this certification have demonstrated that they do know something, that they have these skills. And so a little bit of history about certification in obesity medicine. ABOM was actually founded in 2011, and it was a cooperation between two prior existing certifications, one with the American Board of Bariatric Medicine, and so folks might have heard the term bariatric medicine, and the other was Certified Obesity Medicine Physician. And so these two groups came together and then worked to actually define what are the requirements both for education and testing, and what is the body of knowledge of this field. And ABOM administered its first certification exam in 2012. And as you can see on this graph, really our numbers of certified physicians has really grown exponentially. With this year now, we have over 8,000 physicians across the US and Canada who have active obesity medicine certification. So what does an obesity medicine physician do, which I think is a really important question. And so really we focus on evaluating, treating, and advocating for patients with the chronic disease of obesity and its related conditions. And we focus by doing this on delivering compassionate, unbiased, individualized, and evidence-based longitudinal care, and really focusing on that individual patient health. This is a long-term relationship that we're going to be working with you on. We also focus not only on the individual, but also thinking about how do we improve the health of society at large. So within obesity medicine, we actually have a body of knowledge. And so this is a view of what is that body of knowledge, and an overview or an outline. And as you can see, right now there's 4 different areas that obesity medicine is subsegment into. So there's some basic concepts, things around understanding about the genetic influences, the neurohormonal, what is the epidemiology or the population level trends about obesity. Those basic concepts really provide a key foundation for obesity medicine. The second 2 big columns here are diagnosis and evaluation, as well as treatment. These are the things that you would sort of expect a physician to do. And so knowing how to diagnose not only just obesity, but thinking about all of the related conditions, as well as more rare conditions like different genetic or syndromes that may be related with obesity, are all under this diagnosis and evaluation. Treatment is really oftentimes what we focus most on with patients, and it really runs the spectrum. So we include diet and nutrition and physical activity, a big focus on pharmacology, including anti-obesity medications, as well as other medications that actually may promote weight gain. We also focus a lot on the treatment of patients who are planning on undergoing bariatric surgery, both before, during, and after. Most obesity medicine physicians, unless they are also happen to be a bariatric surgeon, don't perform the surgeries themselves, but we really provide that coordinated care with the surgeon to help patients. We also work with patients on some of the newer treatments that are out there, like endoscopic procedures as well. And then all of this is tailored both to adults as well as children. It really runs the whole age spectrum. And then the final domain that obesity medicine physicians focus on are things like weight bias and stigma. We also focus on how do we actually set up a practice, and thinking about challenges like prior authorizations to really think about how do we provide comprehensive care to individuals with obesity. And there actually has been some research done looking at what type of care do obesity medicine physicians provide. And so if we look at this first column here, we see that 90% of obesity medicine physicians are talking about nutrition, that we have 83% are prescribing anti-obesity medications. And so really it is a a whole host of services that all fall in line with the best treatment evidence that are out there and sort of those clinical practice guidelines. There are some differences in between adults and children because there are some practice differences depending upon what adults and children, what the guidelines say, particularly at the time that this study was done. So I also wanted to give sort of an example. I've given a lot of information, but how does this actually translate into clinical practice, and what might your experience be actually going and seeing an obesity medicine physician? So oftentimes a program goal might be to provide accessible, patient-centered experience for the delivery of multidisciplinary evidence-based clinical services, again with a focus on managing obesity and its chronic diseases. So this is an example from my own program, and so we actually have a multidisciplinary team of clinicians all working together. And so we have multiple obesity medicine physicians who are all diplomates of the American Board of Obesity Medicine. We actually also partner with colleagues in hepatology and thinking about the coordinated treatment of metabolic liver disease, as well as with endocrinology and thinking about partnering on the treatment of diabetes. We also work with close collaborators in psychology, particularly given the overlap between mental health and obesity, as well as our surgical and procedural colleagues as well. It allows the surgeons and the proceduralists to do the surgeries and to do the procedures, and then we provide the obesity medicine wraparound services both before and after those events. A lot of obesity medicine practices have also been specifically designed in thinking about how do we incorporate care for all patients. And so having things like a diversity of chairs in the waiting room, having a scale that can accommodate patients of all weights, patients with different mobilities, having exam tables, again, that can accommodate everyone. That welcoming environment is really key in order to think about minimizing the risk of stigma. And so a lot of times a patient may refer themselves, or a lot of times we get referrals from other physicians. Again, given those knowledge gaps, physicians know that they don't know, and so but they want to get their patients to a program that's going to provide that compassionate evidence-based care. So after a patient identifies and makes a visit, then they'll have an initial comprehensive visit with an obesity medicine physician. And so a lot of times that might be a 60-minute visit, really dedicated to talking about everything in this domain. And so for us, that includes understanding, weight history, prior nutrition, eating habits, physical activity, stress, mood, sleep. A physical exam is conducted along with laboratory testing, and really taking that collaborative sort of shared decision-making approach to set goals as well as tailor treatment plan. And that can run the gamut of lifestyle. Sometimes that may include meal replacements for some programs. I'm talking about medications, talking about procedures, and then any referrals to other providers that may be necessary. This is a long-term, a longitudinal experience. So after that initial visit, then within our program, we offer both individual visits, one-on-one between the patient and the obesity medicine physician, which usually occurs monthly, really thinking with a focus on behavioral counseling and medication management. We also offer group visits, which allows both behavioral, curriculum, goal setting. There's a little bit of one-on-one physician time. And some folks may follow up with a psychologist or a nutrition, really thinking about tailoring what is the care experience for that individual person, as well as those follow-ups with other specialists as needed. So whether that's someone who's interested in pursuing surgery or someone who has metabolic liver disease and needs to be evaluated by one of our hepatologists. So I think another question is, well, this all sounds great. How do I find an ABOM certified obesity medicine physician? And so the American Board of Obesity Medicine, we have a website which actually has a physician directory where you can actually find a physician and verify credentials, which is a button in the upper right-hand corner. The other good news is that there are ABOM certified obesity medicine physicians in every single state in the U.S. This study was conducted a few years ago when the ABOM number of diplomates was a little bit lower than it is now. So these numbers here are only one snapshot in time, and there are now more providers across every state. And really just sort of showcasing that growth over time. So when that study was done, we had about 2,600 physician diplomates. Now we're up to over 8,000 physicians that are certified by the American Board of Obesity Medicine, which really we're hoping improves the access to quality care for patients with obesity. So just a few key takeaways in thinking about what are the potential benefits of working with an obesity medicine physician. I think the first thing is that obesity medicine physicians really understand the pathophysiology of obesity. As I've shown, that's a whole part of the education that goes on, and most importantly is really tested on that certification exam. That this is not something that we've skipped over or something we only spent a couple hours on in medical school. People have spent hours and hours and hours really learning about this and thinking about how do they apply this to the care of their patients. In addition, our physicians are really up to date on the latest science on obesity and its treatment. So after that initial certification, physicians with ABOM actually engage in which is called maintenance of certification, where they're actually required to read and answer questions and think about how different journal articles on that latest science apply to their own clinical practice as a way of helping them, again, stay up to date on that latest science, not only just on obesity broadly, but really thinking about treatment. Finally, it's really important and really sort of a definition of the role in thinking about partnership with patients on care. So engaging in shared decision-making, goal setting together is really important, that this is not a directive care experience, but really working with each individual where they're at and understanding what their goals might be. Every person is unique and different, and so there's not really a one-size-fits-all approach that can be done. It definitely is not an eat less, move more experience. It's really understanding, why are you interested? How do you want to accomplish this? How can we work together? And spending that time and having that close follow-up to really have a true partner, I think it can be really life-changing for individuals. And then finally, we really aim to provide non-stigmatizing care and thinking about not only our own language and how we engage with patients, but as I've shown also, when possible, how we even design the physical layout of our spaces is really critical, that we are welcoming to all who want to engage in this area, because really it's about you and how you want to change your health and well-being, and we're there to be that partner in that journey. So I'll just end by giving sort of a final snapshot highlight here, just for folks who are interested in looking for a physician. And if you go online to the website, it's really at this top here. If you click there, you can just enter your city and state or zip code and find a physician in your area that can work together with you. And so I appreciate the invitation to come and talk to you today. And I wish you all well on your journey. Thanks so much.
The OAC has a variety of educational opportunities for you throughout the year, but one of the best places you can turn to for quality, unbiased education is our resource library. Simply visit obesityaction.org/library to check out our brochures, articles, guides, videos, and more health talks. Also be sure to subscribe to our YouTube channel to get notified about any future educational events. Thanks for joining us.